Hi, everyone. My name is Marianne Regan. Today, I will be sharing about iron deficiency anemia, also known as IDA. Iron deficiency anemia, IDA, is one of the most common, or is the most common form of anemia. The World Health Organization recently shared that approximately 1.78 billion individuals suffer from iron deficiency anemia worldwide. IDA is a hematological condition where there is an impairment of appropriate hemoglobin synthesis within the body due to a deficiency in iron. In the bone marrow of the body, iron is used to produce hemoglobin and red blood cells. Lau stated that iron is utilized to produce approximately 200 billion red blood cells on a daily basis. Iron is absorbed through the consumption of iron-rich food sources. It is then absorbed by enterocytes in the upper gastrointestinal tract. Iron is commonly recirculated through the body via apoptotic erythrocytes, which redeposits iron back into the bone marrow to continue the cycle of making red blood cells and hemoglobin. Iron is an essential microelement within the body. It is necessary for the production of normal, healthy, well-sized red blood cells, and especially is important in the production of hemoglobin. In a healthy body, hemoglobin binds to oxygen molecules. This allows for hemoglobin to successfully transport oxygen to the various tissues and organ systems of the body. This is essential for several major cellular functions, such as respiration, myocardial function, mitochondrial function, energy production, especially in the skeletal and cardiac muscles, as well as cell proliferation and DNA synthesis and repair. When there is deficiency of iron in the body is unable to produce healthy and appropriately sized hemoglobin proteins, making it difficult for our oxygen molecules to bind to hemoglobin and inhibiting adequate distribution of oxygen throughout the body. There are multiple risk factors for IDA. One of the major ones is a diet lacking in iron-rich food sources. Iron-rich food sources include meat, fish, and iron-rich vegetables. Those who follow a vegan or vegetarian diet are at a greater risk for having iron deficiency anemia due to their lack of iron in the diet. And it's necessary that they are very careful that they ensure that they get enough iron within their diet. High endurance athletes, children, and women who are pregnant or breastfeeding have an increased demand for iron due to the increased physiological demands that their bodies has through growth or pregnancy or just being a high endurance athlete. Those individuals also need to ensure that they're getting enough iron in their diet to keep up with the demands of their body. Chronic blood loss from disease processes such as a bleeding ulcer, hemorrhoids, cancer, or an excessive menstrual flow can result in IDA. I'm sure you are observing that women are at a higher risk for IDA than men. Blood loss from surgery has also been seen to be a cause of IDA. Other risk factors include disruption of iron absorption within the gastrointestinal tract due to disease processes such as IBS, Crohn's, or bariatric surgery. Chronic inflammation has also been seen to be a causative factor in the development of IDA. The elderly are also at risk for IDA, and those suffering from disease processes such as chronic kidney disease, heart failure, liver failure, and those with reduced hepatic clearance are at risk for the development of IDA. Signs and symptoms consist of cold intolerance, pallor of the skin or mucosal membranes, irritability, brittling of the hair and nails, menstrual irregularities, tachycardia, shortness of breath, delayed wound healing, and vertigo, headaches, lethargy, and fainting due to central hypoxia. Important diagnostic tests for iron deficiency anemia includes a serum CBC, with the special attention to the serum hemoglobin, serum iron, and serum ferritin levels. An examination of erythrocytes under a microscope could also be helpful to determine if erythrocytes appear to have less color or be smaller in size. That could help us better understand if there's a lack of iron in the body. So I hope you guys learned something today about iron deficiency anemia. If you have any questions, feel free to reach out. I look forward to seeing your presentations.